I don't have to tell anybody in the room this is topical because a lot of people have decided they need to go gluten-free and they feel better that way. There's a real disease called celiac disease, and the difference between really having celiac and just feeling better gluten-free is kind of the difference between sickle cell anemia and regular iron deficiency anemia. These are real different conditions, and I'm here to advocate for the fact that if you feel better gluten-free, you ought to get a diagnosis and know it, because there are long-term complications and real strict dietary issues for that. And if you just feel better gluten-free, you might want to know some of the details about why you do, or why your family members do, or why people that you know do. So even though I'm a pediatric gastroenterologist, this is not a pediatric topic. Celiac disease exists in all age groups and has its onset at any time. You must eat gluten to get celiac disease. So a brand newborn baby doesn't have it, but we make this diagnosis at 18 months of age, and people are newly diagnosed with this at 60 years of age, just like people get diabetes as young people and they get diabetes as old people. You don't always have to have it. Okay, take home points. This is more common than you think, and it comes all kind of ways. You'll all think you have celiac about halfway through this test. It is an immune disease. It is not a food allergy. It is immune mediated. And if I say any medical words that you would like explained, just say that to me. I did not dumb down this lecture for this group. This is a real lecture for this group. And clinical manifestations are variable. Serological means blood tests are quite useful. The mainstay of really diagnosing celiac is a small bowel biopsy. I can't tell you in 40 years of practicing medicine how many people said to me, I don't want to go through that. I don't want to put my child through that. I just think that's completely silly. This is a 10-minute procedure, and it makes a real diagnosis, and it diagnoses other things about you. So I hope that you'll know from me in a completely sympathetic way that you ought to get a diagnosis if you think you might have really celiac disease. Okay, so synonyms. For the first 10 or 15 years I was in practice, I went into practice in 1981. This was called sprue, or celiac sprue. And then it switched over to becoming celiac itself. But I just have to tell you about one of the cute vignettes of my life. There are multiple cute vignettes in everybody's lives. I'm walking into a patient's room, the mom and the child are sitting there, and I'm reading the notes from their doctor in Tennessee. They had just come from Tennessee, and I was going to be maintaining their care. And I just started laughing as I'm reading these notes, which is not the way you want to walk into anyone's office appointment with a doctor. I'm laughing. And I looked at her, I said, I'm so sorry. It says here you're coming for ongoing care of your celiac screw. And she said, oh, we call that celiac disease. And we were fast friends forever, but it does not always go that way. So gluten-sensitive enteropathy, gliadin, which is half of the gluten protein. Gliadin is also a protein. Sensitive enteropathy and non-tropical sprue. You've heard me say the word biopsy. There is a biopsy that looks like celiac under the microscope, and it is tropical sprue. It's a very rare disease. It's treated differently. But non-tropical sprue is another one of the names for celiac. Here's a definition. And this is important to me as a scientist and as a physician, not as just a human person eating things in the world. This is important. A permanent sensitivity to wheat and related proteins in barley and rye occurring in genetically predisposed persons. You will not get celiac if you don't have the genes for it. It manifests as an autoimmune mediated enteropathy, damage to the digestive surface. And the enteropathy is defined by characteristic changes on the biopsy under the microscope. Okay. Originally also, there's all kinds of nonsense that's been a part of this over my life as a physician. It was thought that, like, for the most part, only white people got celiac disease. It was first diagnosed in Europe across the steppes in North America, then South America. And everybody said, oh, Asians don't have this, black people don't have this. Oh, that was before America opened all of its fast food restaurants everywhere. Because corn is gluten-free. Africa did not have celiac disease. They didn't eat wheat. Because rice is gluten-free, Asia didn't have celiac. But now that everybody's got McDonald's and its related things, there's celiac all over the world. Prevalence, high. This is why you've heard these words. This is why you read about it. 1 in 100, 1 in 200 individuals have this. We're going to have 2 slides that kind of look at this in just different graph ways about who's got it. So you take 13,000 people. These people are screened with highly accurate blood tests, not biopsies, but 13,000 of them. If they're completely healthy, they don't have any of the symptoms or signs that we're about to talk about, 4,000 of this considered themselves completely healthy. They still had a 1 in 133 prevalence of celiac disease. So you can have celiac without a single symptom. If you are in a risk group, you have any kind of symptoms, you have a first-degree relative or a second-degree relative, that prevalence goes way up that you can be diagnosed with celiac disease. And then it looks like this in just a little different form. First, second-degree relative, symptomatic children, 1 in 25 will have celiac. So we saw celiac again and again and again and again and again during my years of practice. Hi. So I see some old friends here in this room. Yes?
Can you help clarify second-degree relatives? Is that like an aunt?
That's your cousin.
A cousin would be
yeah.
second. What would an aunt be?
She would also be second.
Okay.
Yeah, first degree are the people who you birthed or birthed from.
Yes.
So yes, an aunt.
Okay.
People who have idiopathic infertility. Somewhere in my life, they just started putting the celiac screening test onto the panel of tests that were done for people who had problems getting pregnant and problems keeping pregnant. Diabetes, 1 in 20 probably have it. Autoimmune liver disease, irritable bowel symptoms, bad bones, osteoporosis. I just got diagnosed with osteoporosis last year because now I'm old. And I said to the lady in the blood place, I said, do my celiac test. I want to know. It was negative, but there you go. Down syndrome, short stature, anemia, arthritis, fatigue, asthma, a few other rare things. Even constipation can present with celiac. Celiac can present with constipation, though it's classic for giving people diarrhea. Okay, why do people get celiac disease? They have a genetic predisposition, and we'll see that, and some kind of an environmental trigger. For sure, gluten, which is wheat, rye, and barley, but probably some other non-dietary trigger. It's known that a few intestinal bacteria and parasites share a little gene sequence with something in wheat, which is a 28 or 22 amino acid sequence. Those things are shared by some intestinal infectious organisms, and probably getting that infection starts the body's immune response, which is appropriate if you have an infection, but then it just keeps on going, and then you respond to the gluten foods from that point forward. Okay, strong association with your genes. 90 to 95% of patients have HLA-DQ2, and then the rest have DQ8. There's just like 1 in a zillion patients with celiac who don't have DQ2 or DQ8. But people come to me and they say, oh, I asked my doctor to do my gene test, and I have DQ2, so I have celiac. That's not the right way to think about that. 30% of us are DQ2 and DQ8 in this world, and only 1 or 2% of us may have celiac disease. But there is some use to doing this gene test if you're negative. If If you don't have DQ2 or DQ8, then you are not going to get celiac. So over the years in my practice, I have had people come to me and say, I want my new baby tested for the DQ2 or DQ8 gene, so I don't have to worry about whether or not I'm going to give them gluten. And that's made some sense to me, especially in families that have multiple people with celiac in them. So there is some use for it, but just having the gene is nothing. Dr. Anderson.
Will that show up on like a 23andMe genetic testing?
Oh yeah, it absolutely comes now. No, that got to be quite a thing in the year after I retired from practice. But I presume people are bringing in those 23andMe things now to say. Okay. And then you can see 10% of patients have a first-degree relative that has celiac. Okay, dietary factors. This is my favorite slide. It's my favorite slide for this tiny little reason. Grains come in tribes, and I just love it that grains come in tribes. The other thing that's interesting about this slide to me is that though these tribes have these great names, I'm not even going to try to say them. A lot of people have said, and there's some historical reason for this, that oats have gluten in them. No, they don't. And they aren't even in the same tribe. So here you go. Wild rice, wheat, rye, and barley. There you go. Those are the gluten-containing grains. And oats are a different tribe. Now, oats bugged people who have celiac disease because at Kellogg's, they put the Wheaties in the hopper and packaged all that up. And then they put the oats in the hopper and packaged all that up, and so the oats had wheat in them. But oats are not a gluten-containing grain. Okay. More about the dietary factors. Oh, it's a 33 amino acid sequence that calls down this immune response in the body. That 33 amino acid sequence in wheat, rye, and barley, and in some intestinal infections, is resistant to digestion in the intestine, and it penetrates the barrier of the intestine and gets into the bloodstream. So those 33 amino acid long proteins come in and say, hi to your bloodstream, I'm here. And if you have a sensitivity to that, then you're likely to get the damage from celiac. And the rest of this is not all that interesting. It just talks about the enzymes that are called into action that damage your intestine in celiac disease. Non-dietary factors, viral infections, parasites, probably some other things will bring out celiac disease. Maybe some toxins, maybe some medicines. We don't know that answer right now. Okay, what happens in the lining of the intestine itself? The lining, called the epithelium, gets infiltrated with the white blood cells, lymphocytes, and there are certain ones of those that are more prominent that can be tested and seen on a biopsy. And then it starts to damage the intestine itself. I have pretty pictures of this, so don't worry about those words. Okay, humoral response, that's how your blood responds to it. You have antibody production against some of the things in gluten. Anti-tissue transglutaminase, the protein that's doing some of the damage, anti-gliadin, and the mechanism of this antibody production isn't known. Okay. Start feeling bad about yourself for the next two slides. Here's the classical presentation of celiac. That you get it when you're a little kid, within the first year or so of starting on gluten-containing foods. 6 to 18 months of age, it's slow onset. You don't look very sick at first, and then you've got a little too much diarrhea, but who doesn't have a little too much diarrhea in their diapers? And then could you grow a little better, and then your tummy isn't going down like the normal 1 to 2-year-old should. And then you get diarrhea. Steatorrhea is fatty diarrhea, that kind of greasy stuff. Poor weight gain, weight loss. The kids are just as irritable as anything. And if I could give you one symptom that all the people who came to my office and told me about, it is that symptom of she's just not our little Jennifer anymore. That change in how people are. And, oh, by the way, lots of people over the years have said, oh, then my husband has celiac. Okay, so not wanting to eat, and then this look of the Life magazine kid in some other country, this big belly and little tiny bottom and wasting. And every once in a while, a kid will present, I don't think this happens in adults, with a celiac crisis where they're deathly ill from malnutrition and dehydration. Okay, late gastrointestinal. We have GI symptoms, and that's these first two slides. We have non-GI symptoms. You don't have to have any intestinal symptoms at all to have celiac. You can just have the infertility and problems keeping pregnant. Okay, late. Can come on any age. And a few years ago, Dennis Ashton, one of the pediatricians at Wasatch, called me up. He said, Janet, what am I going to do? I just got diagnosed with celiac. I said, have you always had it? He says, no, I just got it. I said, Dennis, you could have been tall. But one of the symptoms of celiac is not growing very well. So mainly the GI symptoms are GI. People have irritable bowel and they don't understand it. They didn't have it before and now they've got it. Nausea, vomiting, abdominal discomfort, bloating, a change in appetite, and even constipation. All can be presenting symptoms of celiac. Non-GI, all of these kinds of anemia, because once the intestine is damaged, then you don't digest a whole lot of stuff very well. And one of the things you don't digest very well is iron. And so you can present, because your intestine's damaged, with anemia, and that can be iron, folate, B12, not enough blood cells of any kind, and vitamin K is not digested well by the damaged intestine. In the musculoskeletal system, dental enamel defects, shortness, bad bones, rickets, you can see all of this nutritionally based. And then arthritis and arthralgias. Every once in a while, I think they did a study, 1 in 624 people that come to the arthritis clinic have arthritis that's related to gluten, and they have celiac, and they don't have other symptoms. Okay, in your skin, dermatitis herpetiformis, they call it DH in the celiac world. It looks like, and this group will know this, I try to teach the younger doctors, and there's a picture of it. Looks like micro chickenpox. The little rose petals with dewdrops on them, but they're on the extensor surfaces of your extremities, and they are itchy, itchy, itchy little chickenpoxy lesions. They're called dermatitis herpetiformis, aphthostomatitis, canker sores, eczema, and then all kinds of rashes. Central nervous system. Behavioral changes, the most common and predictable diagnostic thing I ever saw. And even epilepsy and dementia can be celiac related and respond to a gluten-free diet. Okay, so here's the dermatitis herpetiformis. Everybody can hear me? Even back? Okay. And it's just so itchy. You can have a rash that's related to celiac that's not too itchy. Pruritic means itchy. Most people who have this presenting symptom of celiac do not have intestinal trouble. And when they go gluten-free, that completely resolves. Okay, yeah?
Do a biopsy, would you still see it then?
Yeah, they still have a biopsy proven celiac, but they don't have intestinal symptoms when they have this. Interesting, isn't it?
Yes.
Yeah, I just think this whole thing is just, you can have anything and have celiac, as far as I can tell. Prove me wrong when we're done looking at all of this. So, okay, delayed puberty, infertility, recurrent abortions, not, medical abortions, just internal abortions, and menstrual irregularities, all celiac. And then lassitude, weight loss, weakness, edema, liver troubles, cramps, easy bruising and bleeding. Okay. Associated conditions, because there are a lot of conditions that walk hand in hand with celiac, so that when we make a diagnosis of celiac or make a diagnosis of any of these other things, we think to look for celiac as well. So they come both autoimmune and not autoimmune. The autoimmune group, diabetes, type 1, thyroid, arthritis. This is a liver disease and Addison's disease, that problem of the adrenals. Non-autoimmune associated, we check the Down syndrome patients every year when they come to clinic to see if they've developed positive celiac blood tests. Turner syndrome, Williams, and a problem with the immune system called IgA deficiency. Okay, asymptomatic, yeah,
I was a special ed preschool teacher.
yes,
A lot of the parents of my children have autism.
uh-huh.
We're trying gluten-free. Is that association been disproved? That they
Mm-hmm.
because I know there's a lot of digestive issues.
Yes, it's a very interesting question. And it's kind of been answered, not that this isn't a rolling understanding world of celiac, but the autistic kids do not have a higher prevalence of celiac than the general population. They're not like those other kids that we saw. But they seem to have some other sensitivity to both gluten and dairy proteins. And the working knowledge, theory probably more, of that is that they have a leaky gut, they absorb bigger proteins, and they have a leaky blood-brain barrier. And so some of these proteins come into the bloodstream and then go across the blood-brain barrier as a kind of an opiate, and it makes them stoned. So it's pretty clear when they take them off gluten and dairy in the autistic circles if they are the ones that are sensitive, because they're not so stoned anymore.
I had to have gluten-free glue
Uh-huh.
and gluten-free crayons.
Yes.
You don't really put
So,
gluten in your Crayolas.
and that's yet another thing. So for the gluten-sensitive people who don't really have celiac, there are sensitivities to things like crayons, and if you live in Nebraska when they're harvesting the wheat. If you really have celiac, you can put stuff on your skin that's got gluten in it, and you'll be all right. It's just ingesting it that's the problem. So a little different between those two populations. Okay, how do you identify people who don't have any symptoms? Screening of relatives have known cases in mass screening of school children. So that's how we get some of the data that you see in these slides. The problem of diagnosing someone who is truly asymptomatic, who by everyone's, who consider themselves big specialists point of view, don't have any symptoms, is we don't know the natural history of that. We don't know if they're predisposed to cancers and osteoporosis and all these nutritional problems if they're just diagnosed before they have any symptoms at all. And is there a benefit to starting to treat them before they have symptoms? We don't know that. You would think maybe, but we don't know that yet. And are they truly asymptomatic? And that's just in the eye of the beholder, of course. Okay. I would always confirm before treating. We'll talk about some of the psychological toll it takes on people who really need to be gluten-free. And the confirmation of celiac mandates a gluten-free diet for the rest of your life. Almost no one is outgrowing this. We were talking about this before I came up here. It's like outgrowing hypertension. It just doesn't happen to people. Once you've been diagnosed, you're going to be gluten-free forever, so you might as well embrace it. Okay, the diet has potential quality of life implications, and we'll talk about that. And it's why I would always say, at least to parents of a child, let's get this done. It's a 10-minute procedure. Yes, you have a positive blood test, and we can talk about that if you really don't want this done. But then they go off to the missionary training school, and the missionary training school is now requiring your biopsy to give you a gluten-free diet because it's more expensive, and they don't want you wandering off into diagnoses that you don't really have. And some of the schools and colleges, it's better to have that piece of paper in your hand. And then if you get to a point in your life, in my life with patients, it was their teenage years, where they say, I don't really have that, you can say, yes, you do really have that. This can be done with a professional input many ways, but I would advocate for confirming a diagnosis because it means for life you're going to need to be gluten-free, and you know that. Yes?
What do you do when you get a
Oh, we can do these questions at length today, and I mean to stay here for that. But the question is, what if the blood test is positive? You have symptoms, and the biopsy is negative. If the biopsy is negative, you do not have celiac. But I let people eat however they want, because they're going to eat however they want, I do. Anyway, and I say, 4 or 5 years from now, let's repeat that biopsy. And then we repeat the biopsy to really get them a diagnosis, because it will show up, or it will go away. The symptoms will go away too. I mean, the reason that gastroenterology is a hugely successful subspecialty is because people have a lot of gut trouble. So it's also come up many, many times over my life that people have blood tests that are positive, and they come in and they say, I don't have this. For the many reasons you might say, I don't have this. And I say, fine. It's not a completely accurate blood test. I agree with you that you don't need to be gluten-free today. Let's wait a couple, 3 months and repeat that blood test and see if it goes up and down. Some of them will come back negative. So it was some transient irritation in the blood that caused that blood test to be up. So there are ways to kind of work through this, what's complicated or confusing to people. Okay, failure to treat. If you have real celiac, and this is probably celiac, this was named for me by Osher, what's the truth? If you have real celiac, failure to treat has potential long-term adverse health consequences. When someone does not have celiac, but they're better gluten-free and they eat a gluten-free life, if they get gluten, it does not have long-term health consequences for them. If you really have celiac and you eat gluten, you have increased morbidity and mortality in many ways. Yes?
It's not reversible?
What?
You go back to gluten-free diet after a while, does your damage go away?
Oh, once you go gluten-free, you have the health of every healthy person. As long as you're gluten-free, you're as healthy as a healthy person. So, did that answer that question?
The disease doesn't go away.
Oh, yeah, you still have celiac. You just, but,
The damage you've done is reversible.
correct, correct. Okay.
Did you say is reversible?
Yeah, you're going to see it. Okay.
Let's let her talk.
No, yeah, I want the questions. I have been involved in so many, just trying to understand where people are and where I am, where the science is with this. If there's a question, I'd like to go over it. That'd be great, and I'll do it to the best of my ability. Okay, intestinal biopsy. You put somebody to sleep, they don't know they're there. You put a scope down through their mouth. It finds its way through the esophagus, stomach, into the small intestine, takes a little piece. It's about the size of if you catch shaving or shaving. It doesn't hurt. It's a very simple procedure, and it's a 100% diagnosis. Okay. The old criteria used to biopsy people 3 times. You make the diagnosis on the first biopsy. You put them gluten-free. You biopsy them again. You see that it's completely healed. And then you put them back on gluten and biopsy them again. In actual fact, that guideline never really came to fruition, because once people got well and their bowels were healthy again, they didn't go back on for that 3rd biopsy. But that was the recommendation from the powers that be. Okay, new criteria, and this is what's going on right now. 2 requirements: the characteristic histology, the look under the microscope, in a symptomatic patient, and complete symptom resolution on a gluten-free diet. So those are the current criteria for making this diagnosis: that you have the biopsy and that you go completely well clinically today in your life on a gluten-free diet. And the blood tests are highly useful, but they're not part of the powers that be criteria for this. Okay, so I put scopes in people all my life. And once you're in the small intestine, it looks like this. This is really healthy. All these nice little folds, this beautiful color, shiny, reflective, all of this. If somebody has celiac, not always, it can look good like this, But usually it looks like this, and I had to magnify up that biopsy to show you. See the scalloping, just like on a little girl's collar? You see the scalloping, and you see the bumpiness in the intestine. This is, my grandmother could tell you that this was abnormal. And now under the microscope. So this is a normal small bowel biopsy under the microscope. The intestine itself, it's a tube, of course. The surface has these they're called villi on them. And they're long and thin and delicate and beautiful. And they have all your digestive enzymes and what secretes proteins to keep you free of infections. And they make fluids so everything can flow through. These villi are just great guys for us. Underneath them, see the little circles? Those are called crypts. And they're the cells that are the progenitors to the villi. So those crypts are making the villi. And if you get, these are just stage. If you get to the full diagnosis of celiac, you can see that the villi are gone. It just looks like somebody took a razor blade and cut them off. And the crypts are like, hey, where are our villi? We got to get going here. We don't have any villi, so the crypts get big. So those two parts of it. And for the trained eye, this has a bunch more lymphocytes, the purple staining cells in it, so it's much more inflamed than the regular biopsy. Okay, blood tests. Identifying those who need a biopsy or who want to know if they have a positive or negative test to support a diagnosis and to monitor dietary compliance. So if you have a positive blood test and you go gluten-free, that blood test will go to negative, gluten-free. Okay, the tests that are available, probably not too important to you, but the tissue transglutaminase is the most accurate one and the least expensive one. And this is how accurate it is. It's coming. Here it is. 78% sensitive, 98% specific. So if it's positive, you really, really likely have celiac, but it doesn't pick up everybody. So that's just the basis of that. For people who have questions about the other blood tests, there's one called an EMA. That's more expensive. It's slightly more accurate, but you have to kill a happy monkey to do it. So I philosophically felt bad about that. I'm not kidding. You have to kill a monkey to do it, and the monkey has to be not stressed to do this test. So I had patients always say, I've read about this, and we want to have this fancier test done. And I say, no, I'm not killing a happy monkey for you. And then the old tests, the anti-gliadin tests, they were 20% inaccurate one way or the other. So that they weren't too useful. Okay, when would you do the gene testing in asymptomatic relatives to see if you could just forget worrying about them in some of these associated conditions? I don't know. You have to ask a geneticist when they come and give a lecture. Some kind of genetic marker.
Okay. And that's just the way you remember it is.
That's right.
The name of it.
So I have celiac.
Uh-huh.
My daughter, my only child,
Yes.
has been diagnosed. She does not have the gene.
Mm-hmm.
However, she just had a baby.
Mm-hmm.
So can that child have the gene?
If dad has it. So the question is,
Oh.
Granny has celiac, so you obviously have the gene. But you didn't pass the gene to your daughter because your daughter doesn't have the gene. Can the grandchild have it? Well, again, 30% of us have the gene. So yes, the grandchild can have it, but not from you. But dad could have given the grandchild. You don't have to have it from both sides.
So should she be tested?
Oh, no, not until she's symptomatic. The question is, should the grandbaby be tested? If mom does not have the gene, I would say no. Okay. I would wait and just be sane about that. Did we finish that? Okay. Short term, quality of life. Great. you have a resolution of your symptom. Your diarrhea, your bloating, your lassitude, your irritability, your anemia, all the things that were vitamin and protein deficient about you go away. You start to grow, your skin improves, your belly gets flat, all the things you would ever want in life. This is just heaven to have all of these symptoms that go away. And perhaps you experienced this. Okay. And, just sort of everything is good. But long term, especially in adolescents and adults, there's an emotional toll to being gluten-free. And again, I don't want to say this too many times, but I feel like I need to say it right now. If you're making someone be gluten-free, maybe you would have made sure that they needed to be gluten-free, because these kids are, and grown-ups, isolated. They have shame that they can't go to a birthday party and eat pizza and a cake and all of this kind of thing. They have fears that they're going to get gluten, and life is an expanded version of itself when you're a teenager. And if you get gluten, you're going to die of cancer in 2 months, and all of those, and it's hard. They're fearful that they're going to get gluten somewhere, and then they're also fearful that they're going to be a bother wherever they go. It's unwanted visibility. They're forgotten because they don't get invited to things because people are afraid to feed them. Okay, and then the management of daily life. It's a quality of life problem to have celiac disease long term. Once the initial honeymoon phase of feeling better goes away. Restricted choices, it's double work to feed yourself, to shop, to always be surveying what you're eating, always on call. Treatment. Strict gluten-free for life. Avoids all products containing wheat, rye, or barley. Pure oats are safe. Contamination with wheat you have to look at. That's not as much of an issue as it used to be. Now the proprietary cereal factories, proprietary means like Kellogg's and Quaker and all of that. The proprietary companies are a lot more careful about that, so they're not going to put oats in after the Wheaties or whatever it is. They've been tested and studied, and you can get your oats from Quaker and be okay. And then there are ADA guidelines. I have a slide about that if somebody wants to write down and look at the American Dietetic Association guidelines for this. Okay, gluten-free grains and starches. This is just an interesting group of what's gluten-free, but what's most interesting to me is that buckwheat is gluten-free, even though it's called buckwheat. Okay. And so you can go to some of the fancier supermarkets and find a lot of these grains, and then God bless you for trying to cook with them. The lady that owns my Zumba studio cooks gluten-free and paleo, and she makes some darn good cookies and everything else. But if you are new at this and trying to make a gluten-free cookie, or, oh man, once I tried to make some like banana bread out of almond flour, it's hard. You need to watch YouTube or something. Okay, now, a dietitian plays a really wonderful role if you have to be gluten-free. They can give you guidelines about specific things for your lifestyle, for your age, and for your budget. And dietitians just have this sort of wonderful savoir-faire about giving you sane advice. So initial treatment, diagnosis, and then people get good at a gluten-free diet. And then they get another whole level of questions about it 3 or 4 months later. It's great to go back to the dietitian and ask that set of questions too, because like, oh, what about your medicines? Are they gluten-free? And then you can find out www.glutenfreedrugs.com, those kinds of things. So you can see how this is an evolving education for yourself. And to monitor the diet, there's a support group role. I have, for all these years, gone to our local gluten-free or celiac support group. And what's kind of fun about that is that all their snacks are gluten-free, so there's lots of good stuff to eat at those groups. And then they're not special people. They're themselves at that group. Okay, monitoring. Initial follow-up, frequent. We have them back at 2 months. If you bring them back before 2 months, in my business, just in case any of you are trying to go gluten-free, you're kind of suicidal the first 2 months trying to figure out what to eat. And you just have to work through that phase. It's like starting your own business. You're going to make 28 mistakes. You might as well make them as fast as you can. Then you know what you're doing. So the first 2 months, it's just a learning process. And then I would see patients yearly, check their blood tests, check maybe something about their thyroid or their vitamin status, whatever it looked right in that certain case. And then for people who had questions about, am I really gluten-free? Most people who asked that question were really gluten-free. We do their blood test and it was negative, but we would do their blood tests. Or a lot of the kids would say, well, I don't really have this, and they'd start eating a little bit of gluten, and their blood tests would go back positive, and then we would know that for them. Okay. Wait. So yeah, and just re-education, be a cheering section to follow up. Okay, future directions, and I think we're close to a non-biopsy diagnosis. It'll all be done through blood tests eventually, and that's within the next 5 years. We have new genetic markers and improved specificity of these tests. Alternative therapies. Genetically modified food gets kind of a bad rap. But for this particular condition, they can make wheat that is missing that 33 amino acid sequence. And that will make real cookies and real breads and real pastas and those kinds of things. And they'll grow fields and fields of it, and it will be a wonderful thing. Currently, you can, through a study, get a digestive enzyme that'll break down that 33 amino acid sequence. The problem with these studies is that you have to take 12 of these pills per meal. And then there will be immune modulators. There are vaccines studied in Europe now. You vaccinate yourself and you will not become sensitized to the damage that's done by gluten being absorbed in a sensitive individual. So the vaccines will come. So that's the future. This is the resources. I'm going to go on from this, but I'll put this back up again at the end if anybody wants these resources. You can get some really bad advice about going gluten-free unless you stick to some of these real sites. So I would stick to some of these sites, and that's why I'll put it back up. Okay, living as a child with celiac disease, medical data that's of interest. They did a placebo-controlled double-blind study to see, can you get little bits of gluten and not worry about it? And the answer is yes. You can get a little bit of gluten for 90 days without really getting into trouble. Some people have some minimal changes on their biopsies with just small amounts of gluten. Did this go back? Yeah. Okay. Now, we had a question really close to this. What do you do if you have celiac in the family and you have a new baby? So, old news, we were supposed to keep these babies, whether it's celiac or food allergies, off of suspicious things for their first 2 years of life. No peanuts, no whatever it was. Well, they actually did a huge study in families that had celiac, and does it matter when you introduce gluten into their diet? Does it make it better if you keep gluten out for the first 2 years? And the answer was no. If you introduce between 4 and 9 months of age gluten, just like anybody in the world would do, or in our world would do, you would just give them some Zwieback crackers and those kinds of things, give them some pasta, some pancakes. Babies between 4 and 9 months of age in a celiac family, they get used to the gluten and they're less likely to develop celiac as time goes on. If you keep gluten from them, they are more likely to develop celiac as time goes on. So, interesting, huh? It actually turns out to have been true for all the food allergies, too. You should have been giving these kids all this stuff rather than withholding it. So, guess what? In medicine, we were wrong. Okay. You bet.
It says gluten introduced before 3 months led to a 5 times greater risk of it.
Right, a 5 times greater risk. I should have said something about that. We try not to feed 0 to 3 months anything besides breast milk. So, yeah. But 4 to 9 months of age is considered to be the classic great time to do it. So keep them from their Zweebacks. Okay. Let's see. That's not new news. Okay. Should lactose be restricted in people who have celiac? We already talked about the bowel is damaged, and you saw it. It looks like somebody shaved it off. Where are we digesting lactose? Yes, lactase is compromised in a new celiac. But the people who have diarrhea from lactose intolerance because of celiac, which is different from the other lactose intolerant genetic populations, are still going to have diarrhea from it, but the proteins and the vitamins and all of the other things that are in milk and other dairy products are so good for a new celiac that we don't restrict that for them, and we just let the healing go on. And once the bowel is healed and the villi grow back and the crypts go small, all the dairy is tolerated well anyway, so we don't restrict that in new celiacs. Malt flavoring. Does that have gluten in it? Because it should, but except it's sugar. Turns out you can eat malt flavored cereals. Maybe you wouldn't have had this question, but if I'm talking to a celiac group, they want to know if malt's okay. It's sugar, it's not protein, it's okay. And do new celiacs or anybody need vitamins? Yes. They especially need vitamins A, D, E, calcium, and iron. This brings up a question about what is the truth, and hopefully you're really good on truth now, but we'll move on to non-celiac gluten-free. You read that there's been newspaper articles about this now, that if you go gluten-free, you're likely to become iron, calcium, and fiber deficient. Well, you can take care of that. You can eat some spinach and do some dairy products and all of that. So I wouldn't be afraid of going gluten-free if I didn't have celiac, if it made me feel better. And I would take a vitamin if I had celiac or not celiac and were restricting any significant group of things from my diet. Okay, cancer. It's another big question that comes up. Cancer is not a higher risk for people who want to eat gluten-free, non-celiacs. That's not a worry. But if you have celiac, you have a higher prevalence of cancer. It should go down once your bowel has healed to that of the general population, but there are still questions about that in our literature. Several studies show a beneficial effect of a gluten-free diet on cancer. But truly, I see at least 2 general surgeons in this group. People who are diagnosed with small bowel lymphomas may have that small bowel lymphoma be the first manifestation of them being diagnosed with celiac disease. And so it is a celiac presenting problem. Okay, so beneficial effect of going gluten-free on developing those cancers, and it's not just bowel cancers. 12% of adults with celiac disease who do not follow a gluten-free diet develop malignancies. If you don't have celiac and you cheat on your diet, you're not going to develop a malignancy. But if you do have celiac, you better stay good on your diet. Okay, no increased risk of cancer if you've been on that diet for 5+ years. You ask the question, does it heal when you go gluten-free? Yes, it does. But you can't just say, okay, I'm going to heal it for this 6 months and I'm going to eat what I want. I heal it for this 6 months, I'm going to eat what I want. You can't do that. You have to stay gluten-free for 5+ years to decrease your risk of a bunch of this stuff. Okay, and 21 cases of childhood cancer, and this is what's concerning to the world, were found in a European survey of peds GI specialties caring for children with celiac disease. Was it because, they hadn't been 5 years on their diet yet or what, but there's some concern about that. Okay, let's go back to the other slide. Unless you want to see my grandson, and you got a little look at him there. But you probably have some grandsons, so it's okay. All right, let's go back to this. And then we'll just ask and answer as best as I can. Sorry, I should have gone backwards and went forward. There it is. So I'll just leave that up here for now. Yes?
So I have a daughter who was tested for celiac disease and it came back negative at that time. But you were saying that she should be retested. It's been more than 5 years to see if there was.
So the question is, a daughter tested negative for celiac disease. Why was she tested?
Because of all of the GI problems that she was having.
And were her blood tests positive or negative? Do you know? Negative. Okay. So here's the index case. Again, gastroenterologists are in demand because people have GI symptoms. And you saw the graph. If you have GI symptoms, you're much more likely to have celiac. You got her tested, and she had a negative biopsy and negative blood tests. Yes, I would repeat the blood test in 5 years to see. If it were still negative, you already know that that blood test and that biopsy are concordant. I'd repeat the blood test in about 4 or 5 years because it can always develop in any age group. And so if there are still concerns, get it done again.
So then if that was positive, should she again have the bowel?
I would absolutely have a bowel biopsy because you already know that you have an index case who's had years now of intestinal symptoms. You would want to know if you're going to go to the trouble of gluten-free that it's going to work. Yeah. Yes, anybody? This whole table.
Okay. We're in that age group which gets colonoscopies.
Yes, we are.
Okay.
Can everybody hear him? We're in the age group that gets colonoscopies. Okay.
Would colonoscopy pick it up?
No, you can't find it. You have to biopsy the small bowel. On the other hand,
Okay. I know you were going down, but I just wondered coming up.
so the question is, would you find it with a colonoscopy? If you have a little question about this, you can ask to have a upper endoscopy at the same time as your colonoscopy. Again, because you're already sedated, it's 5 minutes to get it done. So just say, biopsy my small bowel, and the costs of that and the problems of just getting medical care are way down. So, Eric.
So the GI symptoms are so non-specific. How do you differentiate it from like other inflammatory bowel diseases like Crohn's disease and things like that? Is that all blood tests now? Or
So I don't know if you heard the question. How do we distinguish Crohn's, ulcerative colitis, celiac, lactase deficiency, giardia, all of these things that give you similar symptoms? All those things I just mentioned can give you exactly the same set of symptoms from one another. And the combination of blood tests, there are screening blood tests for Crohn's and ulcerative colitis, the inflammatory bowel diseases. There are screening blood tests for celiac disease. And there are stool tests to look for some of the infections and some markers of these other conditions. And a combination of a well-chosen blood panel and a biopsy of upper or and lower intestine will distinguish those things. And that's what I did for a living. Because it just looks like a big what to everybody else, but it all looks different to me. So, yes.
and then the other question is,
Yeah.
maybe it's like the elephant in the room, but I mean, I understand celiac disease is true, and that's been. Why is there now like 1 billion people who think they can't eat gluten, even they do not have celiac disease?
What is the truth? About 3.5 million people in America eat a gluten-free diet, which is why there's a market for all the gluten-free stuff, and you see it on the menus. About 70% of them do not have celiac disease diagnosed. Some of them may have celiac disease, but it hasn't been diagnosed. And it's because people feel better on different diets, and we don't always know why. Of interest to you, the group that most benefits from a gluten-free diet in terms of intestinal symptoms and that general sense of well-being and peppiness are related to celiacs. They're known to be non-celiac because they've been biopsied and things, but they are in fact better, measurably in many ways, gluten-free, and they're first-degree relatives and second-degree relatives of people who have celiac. So people do feel better gluten-free. People feel better paleo, all raw, vegetarian, all kinds of stuff, but they do feel better. It has in general, a better quality of fiber because people get more of their fibers from plants than they do from grains. And so their guts work better that way. And there's a big, giant German Institute of Nutrition. And they studied all kinds of people who are better with food restrictions, that consider themselves allergic or celiac or gluten, whatever. They studied a big, big group of these people. And in fact, when you double blind them, they aren't better avoiding whatever food they feel better avoiding. I thought this was kind of rude, but turned out to be true. And so then they went on to try to figure out, why do people feel so much better saying, I'm having a gluten-free diet or whatever the other diet is? And they think, I don't think they confirm this, it's because one, that gives people power over their lives, and people feel better if they have power over their lives. And two, from a chemical point of view, 90% of the body's serotonin, our happy chemical, is in the intestine. Only 10% is in our nervous system. And so if it's making you happy, it's making your gut better. So there may be some real things about that. Like, I could probably go around this room and ask every individual, what do you have trouble with when you eat? And by this age, most of us know. It's scallops, it's red meat, it's that kind of thing. We don't have a name for those conditions, but people know they feel better not eating some things. So maybe that's it.
But isn't it also a chicken or the egg thing, because somebody's making a gazillion dollars?
Yes, they are.
From gluten-free water and gluten-free this, and, I mean, you know, and then it becomes like a vicious cycle, you know, when it's marketed.
I'm in full agreement with even the sentiment that was expressed here, but under what's the truth? The truth is, you can and will eat anything you want. If you have not been diagnosed with celiac disease, eating gluten-free is just a personal lifestyle choice. You don't need to medically eat gluten-free. If you have celiac, you need to. That's check. Yeah.
All this emphasis we have now on probiotics and prebiotics, do they have an effect on the gut health like?
No, there are a couple things that probiotics, and I haven't seen studies on prebiotics, have no effect on. And that is celiac and the other mainstay of my practice during the years that I worked, constipation. They have no studyable positive effect. So, yes.
I'm just curious, are you aware of any studies, like, for instance, my son had juvenile type 1 diabetes,
Mhm.
and now he's developed celiac disease, there's histories of Parkinson's and osteoporosis and all these autoimmune diseases in our family. Is he predisposed to just keep having every so many years, like another autoimmune disease?
Oh.
Another autoimmune disease?
I hate to answer that question, but it's yes. But the one that he's most likely, he has an index case of diabetes, the one that's most likely and should be screened regularly is thyroid. Yeah, those other things can happen, but thyroid really starts to come along. It's about 20% of celiacs over time. Yes?
It seems like when I was 50 years ago, there was no mention at the time of gluten-free diets and all of these things. I'm wondering, has there been some change either to our diets or foods that have changed the triggers for celiac?
Did everybody hear the question? There's absolutely a change in our diets, and there's also something wrong with the universe, but I don't know a better answer than that. I mean, no. Look at this. Look at autism. Look at Alzheimer's. Look at all of this stuff. There's something wrong with the universe, and it probably has something to do with our diets. But if you've ever seen one of those documentary movies of what's happened to our foodstuffs over the world, like we only have 6 kinds of seeds for grain and this, and because of Monsanto and all this, it makes you crazy to wonder what happened to us because of what's in our food. But that's just a little sidelight. Yes?
I have celiac
Mhm.
disease. I also have MS.
Mhm.
And I was told that there is a link.
There is a link. It's another part of that autoimmune stuff. Right. And some of the autoimmune diseases get a lot better if you stay gluten-free.
Yes.
And some don't.
Yeah,
Yes, sir.
Conversely, does gluten problems translate to problems with the thyroid, as opposed to the other way around?
Oh, if you have thyroid disease, should you be screened for celiac? Yes.
Well, we recently, you want to block out